I'm going to assess my equipment. I've got an ophthalmoscope, otoscope, tuning fork, pen light, sharp and dull object, tongue depressor, smelling sense, and ring Dermex. Hi, my name is Mary. I'm a nurse and I'll be assessing you today. I understand this is a wellness visit, so I'm going to perform a head to toe. I'll just look, listen, and feel from head to toe, okay? And let's see, can you tell me your name and date of birth?
Lisa Nightfall, 9483,
Okay, and what month is this?
February
And the year?
2015.
Okay, patient is alert and oriented ×4. Have you had any past medical or surgical history?
I had a tonsillectomy when I was 18.
Okay, any allergies?
No.
Any medications that you're taking?
No.
Okay, all right. We did assess your vital signs prior to the assessment. Your temperature was 98.1. Your respirations were 14. Blood pressure was 120/82. Pulse rate was 70. And you were not experiencing any pain at that time. We also measured your waist to hip ratio, and that was less than 1. Okay, I'm going to assess your scalp. Head is normocephalic, no lesions, nits or parasites noted. Hair is dark, evenly distributed. You can see the skin color on her face is pink. Temperature is warm, no lesions noted. And if you could puff out your cheeks for me, and then raise your eyebrows. Okay. Facial movements were symmetrical and intact, which assessed cranial nerve number 7. And I'm going to do a sensation on your face. Let me know if it's sharp or dull. Dull. Sharp. Okay. Sensation was intact, and that was testing trigeminal nerve number 5. And next I'm going to assess your eyes. See, sclera is white, conjunctiva is pink, intact, no lesions noted. Lacrimal puncta is also intact. Eyebrows and eyelashes are evenly distributed. We did assess your visual acuity prior to the assessment. With both eyes together, you had 20/20 with the corrected lenses using the Snellen chart, so that was good. I'm going to test your peripheral vision. If you can include, close up one eye, and let me know if you see anything.
You waving?
Okay, I'm going to do the other side,
Okay.
and again.
And you're waving again?
Okay. Peripheral acuity is intact and equal bilaterally. That was the optic nerve, cranial nerve number 2. I'm now going to assess your pupils. Okay. Pupils were equal and reactant to light, dilated from a 3 to a 2. You can hold your head straight and follow my pen line. And then if you can look at me, and then look behind me, and look back at me again. And then on the other side. Okay, pupils were equal and reactant to light with accommodation. That was testing cranial nerves 3, 4, and 6. And now I'm going to use my ophthalmoscope to test the red reflex. Red reflex was intact and present along with the optical disc, fundus, and maculae. Let's see. And I'm now going to palpate your sinuses. Let me know if you feel any tenderness, okay? Any pain or tenderness noted?
No.
Okay, no pain. Okay, now I'm going to inspect your nose. Let me know if you feel any pain or tenderness. Okay, nose was palpated without tenderness. Color is pink. Temperature is warm, dry, no lesions noted. If you can tilt your head back, please. Septum is midline. No lesions or exudate from the nasal mucosa. It is moist and intact. And I'm also going to perform a smell test. If you can just let me know what it is that you smell.
Cinnamon?
Okay. Let's see. Cinnamon. That was okay. Testing the cranial nerve number 1, and if you can also include one nostril and breathe in and out, and same with the other side. Okay. Nares are patent and equal bilaterally. Now I'm going to be assessing your mouth. Lips are pink, moist, no lesions noted. I do have a tongue depressor that I'm going to use as well. If you can stick out your tongue for me, move it side to side. Okay. And tongue is midline with normal movement. This tests cranial nerve number 12. You can say ah. Okay. Uvula is midline with vocalization. If you can cough, please, and swallow. Cough and gag reflexes were intact. Let's see. And if you can clench your jaw, please. Okay. See, that assessed your cranial nerve number 5. And if you can open up your mouth, again, I'm sorry. Oral mucosa is pink, moist, no lesions noted. And we assessed your taste earlier. That was assessing cranial nerve 7 and 9. That was intact. I'm going to be assessing your ears. Let me know if you feel any pain or tenderness. Okay. No pain or tenderness noted upon palpation. Auricles are elastic. Color is pink. Temperature is warm. And again, no lesions noted. I'm going to use my ophthalmoscope to assess the eardrum. Pull the pennant down and back. Tympanic membrane is intact, shiny, opaque, no exudate. And that is equal on this side as well. Let's see, now I'm going to do your hearing test. I'm going to first perform the Weber test. Let me know after I put the tuning fork on top of your head if you can hear the vibration, and when you can't, let me know and I'll move it down to your ear, okay?
Okay. Okay.
Okay. The Weber test was intact, and I'm going to now perform the Rene test. So I'm gonna let me know whenever you don't hear the vibration, and I'm gonna move it to your ear. Okay. And the Rene test was intact, and that was assessing the cranial nerve 8. Now I'm going to be assessing your neck. The color is pink, temperature is warm, dry, no lesions noted. And let me know if you have any pain or tenderness. Okay, trachea is midline with no tenderness noted. No JVD is present. And if you could touch your chin to your chest for me, please. And then extend it all the way back. And your chin to your shoulder. And then the same on the other side, please. Okay, patient does have full range of motion. I'm going to palpate your lymph nodes, okay? Your preauricular, your postauricular, your occipital, your submandibular, submental, anterior cervical, posterior cervical, and your supraclavicular. And if you can, push up against my hands, please. All right. Cranial nerve 11 accessory was intact. Okay, I'm now going to palpate each carotid artery. They are visibly able to be palpated. And I'm now going to assess the lung sounds in all 8 lobes. You can take a deep breath. All 8 areas. Take a deep breath. And again. Again. And again. And again. And again. And I apologize one last time. Okay, lung sounds were clear to auscultation. I am now going to auscultate the heart. See the aortic. I would listen for a full minute. Pulmonic. Herb's point.
mitral.
I would hear S1 best at the mitral and S2 at the aortic. I'm now going to turn my stethoscope and use my bell in the aortic, pulmonic, Erb's point, tricuspid, and mitral. And again, I would auscultate for a full minute. Okay, and see, now I'm going to listen and palpate. Now I'm going to auscultate at the mitral and palpate the carotid. That is equal bilaterally. And I'm now going to use my bell to assess for bruits. No bruits noted in the carotid artery. And I'm going to auscultate the temporal artery. Okay, now I'm going to assess the back. If you can turn around, please. Okay, patient's back is warm, pale in color, no lesions noted, few moles, but no signs of further assessment. I'm going to auscultate the posterior. If you can take a deep breath, please. And again. And again. And again. You go underneath your shirt. One more time. And again. And again. Okay. Just 2 more times. Okay. Patient's posterior lung sounds were clear to auscultation. You can repeat after me. 99.
99.
99.
99.
99.
99.
Okay. Tactile fremitus was intact and equal bilaterally. You can take a deep breath for me. Okay. Respiratory excursion was equal bilaterally. Let me know if you feel any pain or tenderness. Okay. No tenderness upon palpation of the CVA. And now I'm going to have you lay down and assess your upper and lower extremities and your abdomen.
Okay.
I'm now going to assess the abdomen. Okay, it is flat, soft, warm in color, pale temperature, no lesions noted. And I am now going to auscultate in all 4 quadrants. And I would listen for a full minute in each quadrant. Okay, bowel sounds were normal active times 4, and I'm going to listen to the epigastric, see if there's any bruits noted. No bruits noted upon auscultation, and let me know if you feel any pain or tenderness.
No.
Okay, no pain or tenderness noted in the abdomen as well. And I'm now going to assess your lower extremities. Before I assess your lower extremities, I am going to palpate your abdomen. Let me know if you feel any pain or tenderness.
No.
No? Okay, and now I'm going to assess your upper and lower extremities. Okay, I'm going to assess your axillary nodes. Color is normal to ethnicity. So let me know if you have any pain or tenderness in the axillary nodes. Okay, no pain or tenderness noted in the axillary nodes. And I'm going to perform the Allen's test. I'm going to raise your arm above your heart. You can clench your fist for me a few times. And go ahead and do it again. Okay, and not occluding the ulnar artery shows adequate perfusion. And I'm going to assess sensation, sharp or dull, and it'll be on your upper and lower extremities. Let me know where it is and if it is sharp or dull, okay? If you could close your eyes.
Right arm sharp. Left arm dull. Left leg dull. Right leg sharp.
Okay, feeling sensation is intact on the upper and lower extremities. Upper extremity color is pink, warm to touch. No lesions noted. Few tattoos are noted, but no signs of infection. Cap refill is less than 3 seconds. Skin turgor is immediate. Let's see. Radial pulses are bilaterally, as well as brachial. Okay, and if you can rotate your wrist for me, okay, and your shoulders. Okay, and if you can squeeze my fingers and release, okay, and squeeze them again, and then release, okay, and then if you can push up against my hands, great, and then, good job, okay. Full range of motion in upper extremities, strength is adequate. Now I'm going to move down to the lower extremities. Cap refill is less than 3 seconds, no edema noted. Dorsalis pedis pulses are bilateral, as well as posterior tibial. Popliteal color is pink, temperature is warm, no lesions noted. If you can rotate your ankles for me, okay, and your knees, if you can bend them, okay, and the other one, thank you. Okay, full range of motion in lower extremities as well.
Okay.
Okay, that concludes our head to toe assessment. When we are finished completely, we will discuss the proper way to do a monthly self breast exam. Thank you very much, Lisa.
Thank you.